We're back on Born Before 64 with Dr. James Butler. And, you know, let's give your website out. That would be really important.
Okay, you can find us at implantdentistryhilliard.com, Hilliard, Ohio, Hilliard. And you can also find James E. Butler, DMD, on Facebook.
Wow, you're on Facebook just with me? Oh, good. Let me ask a question. Right before the break, we were talking about, you know, a lot of people don't really know a lot about dentistry, and they're too afraid maybe when they get into the dentist office. I just happened to find a very kind, gentle dentist back, you know, near where I live.
Right.
And he used to do the same thing. He used to hide his dental cards too, so we kind of get along pretty well. But he doesn't do cosmetic dentistry.
Right.
So that made it hard for me, you know, to have anything really done with him. And so anyhow, we were talking before the break about veneers. Let's talk about veneers and how they work with implants and why we use them. Okay?
Yeah,
so
absolutely.
let's talk about it.
Well, veneers can be used when the tooth is fundamentally sound in its core. You know, it's a healthy tooth, but it's been taking a beating. Maybe there was a little filling that's worn out, or there's a chip, or it's been cracked and stained because of the, you know, stain getting into the pores of it. You can resurface those just like doing a false fingernail, and that's what a veneer is.
Oh,
but
really?
It's a very
like a false
high-tech
fingernail, like these?
Yeah, exactly. And see how pretty those are.
Yeah, right.
And we can make the teeth the same way, except they're not plastic. They're porcelain usually. And porcelain is very durable and it looks very beautiful and looks like human enamel when done properly. So we've, in my laboratory, we do the lumineer style veneers. We do the stacked porcelain veneers, which is the one that Bill always used. We can use. I think he did use some pressable. But what they are is they're basically little films of tooth-like substance that then get glued onto your own teeth with a process called bonding, and are held very tightly and can stay on for years.
Oh, really?
And then you can do color and size and shape change with that. It's wonderful.
You can?
Yeah, absolutely.
Well, see, one of the reasons why I told you a couple of things about my case per se, and I have TMJ, so that didn't help, and then I grind, so I wear a plate at night.
Right.
So, but when you use your mouth as much as I do, you know, with interviewing and with television and with all the different things I do, you want to be able to smile, and you want to be able to show your teeth.
Right.
And I don't want to be touched up on film. Instead, I'd rather be just natural and be able to smile just like you do with those gorgeous white teeth of yours. And I bet you're really proud of those, right?
Well, it's taken some work to get them that way because I was hard on them. You know?
You were really tough on them.
Oh, I was tough on them. You know?
And, you know, the other thing I want to talk about is a little bit about whitening, because a lot of people are very sensitive to the whitening products that are out there today.
Right.
So is there some that you have in your office that are better than others?
Yeah, we use a lot of Bill's products from Discus Dental. They're good people, and they've used a lot of fluoride research to try to desensitize the teeth. When we do the light whitening, the so-called Zoom 3, which
Zoom. Which tell me a little bit about that before we get into some other subjects here.
Well, the idea of the light is to activate the bleaching agent so that it goes very, very fast and very high concentrations, because all whitening is really simple. It's how many molecules you get agitated on your tooth at any given time and how long they stay agitated. So, you know, the power burst of the molecule. So when we're whitening teeth, we want to do our best to agitate and heat and to light activate the bleaching agent, okay? And most of the other bleaching agents that you use at home, you know, they work at lower agitation levels, you know, lower percentages.
And it takes longer to do it.
So it takes longer, yeah.
And I mean, it could take up to sometimes 6 weeks for that to get white.
6 weeks,
yeah. How fast does Zoom work?
Well, Zoom works in about an hour, you know.
Does it hurt afterwards for people that are sensitive?
You know, there are occasions when it does, but we use a preventive, so we have very few occasions. So
let me ask you, what about the preventive? Let's talk about that.
The preventive it's a high concentration fluoride paste that we use for a week before the Zoom appointment.
Okay.
And it usually protects your teeth from that type of irritation. And it's a transient inflammation from all of the chemistry, and there's never a permanent harm, but it can be annoying if you do get sensitive for a day or two. Okay, certainly it can be
I
annoying.
could probably deal with it. I just, you know, I remember going through the little plates that the dentist gave me, and he had to stop on 1 or 2 days because a couple of days it got really sensitive. And I don't know, you know, but I think I can probably take any kind of pain anymore just to look good. Is that probably it?
I think that's a hallmark of Born Before 64.
Right.
Our willingness to get things done.
Get things done, get them done fast, right? Tell me a little bit about, you know, when you go out to train, and you've got 3 patents out there.
Yeah, we have 3 patents pending in the laboratory portion of this. We're working on a process to replace dentures with natural feeling teeth and do that in weeks instead of months.
Wow.
Yeah, it's really going to be exciting. And also different ways of helping the laboratory produce something called an integrated abutment crown, meaning it's one piece that glues on instead of 2 pieces like traditional implants. So we're working with that too.
And that will be a crown that would go in your mouth easily?
Yeah, on top of single-stage one-piece implants.
Okay.
So.
We're going to go right now and look at these. We're going to take a break, and then we're going to come back, and we're going to do these videos, and it's going to be awesome.
Thank you.
And we'll be right back on Born Before 64.
We'll be right back on Born Before 64 after this commercial.